Hello everyone, I am Professor Smita Jha from the Department of Humanities and Social Sciences at IIT Roorkee. I am delighted to introduce my online certificate course titled Health and Disability in Humanities, offered through NPTEL, an initiative by the Ministry of Education, Government of India. The proposed course will discuss health humanities, which focuses heavily on the subjective experience of illness and the clinical encounter, and disability humanities redefines disability not as medical deficit to be cured, but as a rich site of cultural, political, and historical identity. While often used interchangeably, the shift in terminology represents a major ideological evolutions. Now, what are those ideological evolutions? Let us know about it. Medical humanities, that historically focused on training physicians, utilizing the arts and humanities primarily to improve narrative competence and doctor-patient communication. Health humanities broadens the scope to include all healthcare workers like nurses, therapists, social workers, family caregivers, patients, and marginalized communities. It emphasizes health as a cultural, socio-economic, and political reality rather than just a medicalized experience. The current academic and institutional understanding of health humanities marks its transition from a secondary, supportive teaching tool into an independent, rigorous, and highly critical interdisciplinary field. The course consists of approximately 60 lectures, each lasting 30 to 40 minutes, and spans over 12 weeks. A comprehensive curriculum at the intersection of health, humanities, and disability studies is typically structured as an interdisciplinary 12-week undergraduate or postgraduate course. Rather than focusing on clinical pathology, the syllabus explores how society, literature, art, and politics shape our understanding of the human body, health, illness, and ability. What are the core thematic modules of the proposed course? So, foundations of health, body, and power concept. So, shifting definitions of health, illness, and sickness. Then, the medical gaze, Michel Foucault's theories on clinical power and the evolution of institutional spaces like clinics and asylums. Then comes theoretical models of disability, medical versus social model, decoupling bodily impairment, the clinical variation from disability, the social barriers and systematic exclusion, the cultural model, investigating how language, media, representations, and history frame disability either as a tragedy to be cured or a form of human diversity. Then comes representation in narrative and art. Illness narrative, reading pathographies, memoirs of illness to understand the lived subjective reality of patients. Then comes graphic medicine, analyzing how visual media and comics depict chronic pain, neurodiversity, and mental health. After that, it is prosthetics and the cyborg self. One of the very important core themes, critiquing how assistive technologies, accessibility aids, and curing narrative shape our perception of an idealized whole body. And the title of the lectures are Introduction to Health Humanities and the core area, which will be the first. Week 2, Introduction to Histories, Theories, and Methods in Medical and Health Humanities. Third will be Narrative of Healthcare, Illness, and Disability. Fourth will be Introduction to Narrative Medicine. 5th will be Introduction to Graphic Medicine. 6th will be Literature and Medicine. 7th will be Bioethics and Medical Humanities. 8th will be Indian Health Policy, while 9th will be Pandemic Politics and Policies in the World 1918 and 2020. 10th, Promoting Health Aging, and 12 will be about the deep literature and other ancient theories. By the end of the course, participants will have a thorough understanding of health humanities. To earn a certificate, participants are required to complete weekly assignments designed to reinforce learning outcomes. A proctored examination will be held at the end of the course to assess overall performance. I invite you to join me in exploring this exciting and evolving field. Thank you, and I look forward to having you in the course, which is the need of the hour. And if we talk of medical and health humanities, this will bring a revolutionary change in the field of medical science. Thank you very much.